Welcome back to another episode of the Fill Me In podcast. I'm Injector Jon.
And I'm Aesthetic Nurse Nicole.
Yes, and we are here on a Friday night at 8:30 p.m.
Here we are, showing up, wet hair and all.
Wet hair and all. Me, I'm in my loungewear at my lake house, enjoying it, having a quiet Friday night. This is what happens when you're 34 years old.
But listen, last weekend wasn't that quiet, okay?
It wasn't. Aesthetic Extender was nothing but quiet. It was
Kept us
stimulating,
busy.
Fun. Oh my God.
Oh,
Absolutely.
the people we met. We made so many new friends.
We really did.
It was
We
great.
did.
I
We
can't
made
wait for
some
next
good
year.
connections. I know.
We did.
It was fun. So we're going to be talking about a really fun topic today.
Yes.
And it's going to be talking about the wild, wild west of aesthetics, right, Nicole?
Absolutely.
And who should actually be allowed to do this.
Mhm.
And, you know, there was a recent story that brought renewed attention to med spa oversight, credentials, medical directors, IV therapy, patient safety, and how difficult it can be for consumers, aka patients, to distinguish a beautiful business from a medically responsible one. So I think a lot of people are getting fooled. And, you know, I think a great example of this is Hannah, the comedian.
Our poor girl Hannah from Giggly Squad.
From Giggly Squad with Paige
my
DeSorbo.
God.
We'll get into
I know.
that.
You see these people, right? They have all the money in the world and they end up with a double Risorius issue and they can't smile. The poor thing.
They have a social media platform. You think that there's someone to look up to. They're going to go to someone who's distinguished, professional, has credentials. And these people might still have credentials, but are they doing it the right way?
Right.
Yeah. So I guess the first question I'm going to put out there for this episode is, does a huge Instagram following mean anything clinically, Nicole?
Absolutely not. Absolutely not.
What do you mean?
You know,
because you have 28,000 followers. I mean, if I
doesn't mean
saw
I
you,
can trust
Nicole,
you.
if I saw you, Nicole, on Instagram, if I've never known you and I saw how many followers you have, I'd be like, oh, she seems legit.
Yes, I think definitely the amount of followers plays a role, especially in a patient's mind.
Yeah.
But I think it's something that they should not solely base their decision off of. I think once you see that number, that's great. That's cool. That means they're active and they have followers. But then you need to dig deeper. Are they posting before and afters? What do they look like? One, because you want your injector to look like somebody that you want to look like.
100%.
You know, before and afters. And then their credentials. You can look anybody up online. You need to be looking and seeing if they're actually licensed and if they're reputable. Reviews, all that good stuff.
Yeah. And I mean, I think we all fall into this scenario because even when I was an injector, I followed someone based on their hype. Like, oh my God, X amount of people go to them, I'm going to go to them. You know, and I mean, if a lot of people go to these people, it's a good sign. But I think you definitely have to go on their website. You have to look at their Google reviews. I truly, the amount of people now that I get just from Google, it's word of mouth is number one. But the second one is Instagram and Google. And there are people coming from out of town. And I'm like, oh my God, you found me on Google? Like, this is amazing.
This is great.
Like,
Those reviews matter so much.
They're like, we went right to the reviews. Everything was great. You know, you seem you don't seem pushy. You seem real. You'll say no. And that means a lot. So I think, you know, if you're a patient and you're listening in, just make sure that you're doing your due diligence and not just going to someone because of their Instagram following, because there's a lot of people and injectors that are doing clickbait type of things on Instagram and they're finding topics that they know will get traction and make their video viral. And just because, you know, they're getting all of these likes and comments doesn't mean that they're a good injector, which sounds awful. There's a lot that do these type of posts that are good.
Great. Yes.
But there are a lot that aren't.
Yeah.
Too.
I think the point is we're trying, like, even if they have 500 followers, they could still be an incredible, like, do not make your decision based off a follower count. Absolutely not, because it's the credentials that matter 100%. There's someone that could have 500 followers that's an award-winning clinician, you know?
Yeah.
I think, though, in today's day and age, unfortunately, patients do look at that. And I think it's important if you're a patient listening, that you do your due diligence and look into it, because there's also these, you know, people that travel from overseas and they do pop-ups in like Florida and New York and they have a ton of followers and the results are crazy because they're photoshopped.
Yeah.
And people go, and like if you dig deeper into that, you'll find some things, so like just Google the people, Google their name, Google their business name, and really pay attention, because you don't want to end up seeing someone that's gonna fly back the next day to another country and you're gonna have no one to see if you have a complication.
Yeah. What do you think about, I mean, when I first started, I don't know, you worked at a plastic surgery office. I worked at an aesthetic, like, med spa that was mostly esthetician run.
Yeah.
And back in the day, like 8 years ago, Groupon was a huge thing. And they used to run a lot of Groupon. I mean, when Groupon started, I thought it was actually kind of good.
Good, yeah. Yep.
And so I think a lot of practices were going to Groupon to bring people in because they knew that it was like a hype thing and people were doing it. But over the years, it's not become like that. It's become very shoppy and people are just looking for deals. So what do you say?
It's gotten a bad rap. Groupon's gotten a bad rap. I do, right? Especially starting out, I know.
Do you use Groupon, Nicole?
I don't.
Yeah, same. I don't.
I
Run
don't.
the other way. If you see a med spa on Groupon, run.
Just please run. I think there's many better ways to do promotions than utilizing something like Groupon,
Yeah, there is.
There's many other ways to get your name out there. No, I would agree. I don't think Groupon's a great idea. And I think if you're a new injector listening, Jon has a lot of input on this, like using the people around you, right? You did a lot of salons and stuff when you first started, really gaining clientele. Like, use the businesses around you that you can collab with in ways like that. Like, oh, if so-and-so sent you $100 off, more word of mouth where people can actually really trust you. And
yeah, I mean, I think I don't even say use, I partnered and collaborated with other salons and other people that, like, initially when I first started, because number one, I wanted to do it, and I thought it was a good outreach. It gets your name out there. But I did it the right way. Like, I had malpractice insurance that covered me when I was there. I brought all of the necessary products that I needed to perform those treatments. I was in a room that had good lighting, that had the resources I needed, right? So I wasn't going to people's houses, to do them. So yeah, I think it's really, especially at least when you're first getting yourself out there and getting your name out there, I do think they have a place. Like, I think it's great. If I could still do them now, I would. It's just, humbly, like, we're just so busy in office that I don't have the time to do
like
weekends and do like that anymore, unless it's like worth it,
No, absolutely. You just made me think of something, mentioning the malpractice. I think there's so much behind the scenes that patients don't realize that we do. Like, I had a patient come in the other day for nose filler, and of course, as all of my patients know, I will always explain the risks to you. There's never going to be something that I do and you don't know that there's a potential of something happening.
A good informed consent.
Yes, exactly. And she got very nervous after finding out, the potential of blindness. And, I went over everything. I said, listen, the reason I tell you this is not to scare you, but it's because it's a potential and it's a documented adverse event. And if I were you sitting in that chair, I would want to know it's a potential that could happen to me. And she was like, no, and I appreciate that. But I went into the details of, like, listen, you wouldn't even know if I didn't tell you this, but I'm staying midline. I'm staying away from specific structures. I'm aspirating. I'm down on bone. I'm using a specific needle. I'm only injecting a certain amount per spot, and I don't inject more than 0.2 in a nose ever. But these are things that we never really say to a patient, but we're doing them behind the scenes in secret, to keep them safe. So I think it's so important sometimes to, like, remind your patients, like, listen, I've taken X amount of trainings. I read the research. I'm doing everything in my power to keep you safe. And going back to that whole, like, does the Instagram following mean they're safe clinically? Like, also ask your providers if they have insurance, right? Like, God forbid something does happen to you. Do they have malpractice insurance when you're going to need something? Are they going to be able to cover that cost? Like, these are important questions,
Yeah, for sure. I agree with you. What else do you want to talk about, Nicole?
How do you feel about weekend courses for injecting?
Oh boy.
I think everything has a place, right?
Took one.
Yes,
when
me too.
I first started, 7.5 years ago. I felt like it was necessary to do before I started where I was going to be starting. And it involved lip filler, smile line filler, marionettes, and the look of 3. And it was good, but, like, I left and I was scared. Like, I mean, I
Absolutely.
injected maybe 2
Almost
or
more
3
scared,
people.
right?
Yeah, and I was thrown into it. So, with that being said, I really think it depends on the person if they're really motivated enough to watch educational videos, do more training, pay out-of-pocket costs for trainings, ask the medical director or whoever you work for, further trainings on, comprehensive Botox, glabella frontalis, crow's feet, platysma, and then also, like, further training on, like, full facial balancing. If they don't offer CME, then, I mean, you have to do these out-of-pocket things. For me, it was a different era back then. Like, I was on YouTube, I was on Instagram. I wasn't really on Patreon, but I was nonstop watching videos after videos after videos
Right.
after working in the hospital and then working 3 or 4 hours at the med spa, going home, and I was just watching,
Right.
like,
Watching and learning.
because I saw who was in my schedule, and I'm like, I
Mhm.
have to know how to do cheek, lip, do it safely. So, with repetition, it got better, but then, I started having the money to go to more trainings, and I remember charging my card, looking at my husband and saying,
Right.
"We'll figure it out. It is what it is, but
I'll make it back. I'll make it
I
back. Yep.
love this so
Yep.
much, and I wanna be really good at it, so I
Mhm.
need to know properly how to do these things safely." So,
Yep.
weekend courses, I think, have their place, but you have to
Mhm.
follow up with it. It's kind of
Yes.
like an Allergan training, a
Mhm.
Galderma training, Revance training. If they come and do the training for you and you basically you've only injected 2 people before the training, you have to get models in immediately thereafter
Yes. Yep.
to then,
Be able
put
to implement. Yes. Yep.
implement everything that you learned right away, because
Mhm.
honestly, when 4 weeks goes by and you haven't, what was the point of that training?
Yep.
So, I think weekend courses do have their place. I think it makes you look more reputable for
Mhm.
when you're applying for other positions at practices, whether it's derm, med spas, right? It makes you look more advantageous.
Mhm.
But I think, just to rely on them and then open up your own practice,
Mhm.
I'm
Not
not a
great. Yeah.
fan. I
Yeah.
think you do that, and then you work for someone, gain experience, gain a following, and then open up your own place if
Mhm.
that's something you want to do. Some people don't want to do that. They want to
Right.
work for someone forever because business is not their forte, and I don't blame them.
Right. Right. And I think it's important too to highlight like these weekend courses. Even though you get a cert afterwards, you're not certified. There's no certification in what we do, and I think a lot of the time that definitely gets people that have never been in our field and they're like, "Well, I'm gonna
Yeah.
take this, I'm gonna be certified, I'm gonna get a job in this." It doesn't really work that way, unfortunately, and I think
Yeah.
sometimes these weekend courses will charge people a crazy amount of money, 3 to 5,000, and, they teach them the basics and they give them a certification and they send them on their way. I think it's definitely necessary if you're trying to get into this field, it's absolutely necessary to try to learn the basics that way, but like you said, it's about repetition, implementing, and
Yeah, and
and
as a
gaining
business
further.
owner, as a practice owner, if I'm hiring an injector and they went to a weekend course, right, and they absolutely loved it, I'm at the stage where I've trained 2 brand new injectors, right? They're great. They're doing
Mhm.
wonderful. To hire another brand new injector, it's a lot, right? Like, it
Absolutely, yep.
takes your time and investment to train them, and I would totally do it again. I guess if someone came to me and they had done a weekend course, I guess what I'm trying to say is I don't know
They're
if I
eager.
would. They're eager, but I don't know if I would fully hire them at this point.
Because you're not
I
looking for
would
someone new anymore. You're looking for
I'm
someone
looking for someone
experienced.
who's a little experienced, but
Mhm.
also if they did go to the weekend training and they walked in, handed me
Mhm.
a
Right.
resume,
Right.
I they're more apt to
Yep.
hire them because
Exactly.
I people that just email their resumes
Mhm.
and they say they've had a cert I've never met you before.
Right.
Like, make a really good first impression. Walk
Mhm.
in, meet my manager, meet my front
Yep.
staff, and be like, "This person's walked in, hand me their resume, they're really interested, they seem great, they have a good
Mhm.
personality." Like, "Okay,
Like, look, okay,
I'll
maybe.
take it more seriously."
Yep.
But if I just get a resume via email,
I know,
I'll
and
hold
it's
on
like
to it.
how many of those emails do you get? It's hard to,
Yeah, and
sort
I
through
don't
them
mean
all.
that in a mean way.
No, of
It's
course not.
just
Yeah.
I think anybody who's looking to get into aesthetics, you need to walk in
Mhm.
and you need to hand your resumes to any practice that you're interested in
Yep.
working at.
Yep.
I think it goes a long way.
Absolutely. How do you
Sh
feel about Oh, go ahead. Did you
No,
have
go
a
ahead.
thought? No,
Mm-mm,
how do you
no.
feel about do you think, patients should know who the medical director is?
Yes, I do. I think it's very important. I think there's 2 sides to this.
Mhm.
I think there's some aesthetic practices that, depending on your state and where you live in, I think there's some very good NPs and PAs that are very reputable, do things the right way, have protocols, have complication management, right? They're very compliant and they're good injectors, and they hire like a medical director service to, to cover it over them. So that way they can check all boxes.
Right. Absolutely.
So there's that, and I'm sure there's a bunch around the United States and they're doing a great job. But for me, I'm the medical director of my practice in New York State. NPs, if you have over 3,600 hours of clinical, right, in-person clinical, then you can be a medical director. So for me, yeah, everybody knows I'm the medical director. So I think that's very good for them, and they make the practice seem more reputable.
Yeah, I think it's important that too you have like your newer injectors, right? They have you to turn to. I think the importance of a patient knowing who a medical director is knowing that, God forbid, there became an issue, you have someone that you can pull in, or you have even these places where you might not have an MD, you have protocols, you have people you can reach out to. Like it's just, again, it's like doing your due diligence on a practice and making sure that they have the protocols in place that, God forbid something did happen to you. Do they have a hyperbaric chamber they can refer you to? Do they have this? Do they, So as much as the medical director matters, because I do think having someone to fall back on and bring someone in if you do have an emergency, if you need them, is important.
Yeah.
But it's all about the protocols and making sure that the practice you're going to is practicing safely.
It is. Yeah. Like I said, like if you're a reputable, NP, PA, RN, and you own your own practice and you have a medical director service, right? Just make sure you're doing things the right way.
Right.
But do I think it makes a difference knowing who the medical director is? I think it can, especially, at least for me in New York State, like, with NPs, things like that, owning your own practice. People love that. They know that I'm there. Like you said, like if there's anything wrong, I can take care of it.
Right. Yep.
But all my practitioners in my office know how to handle a complication. So even if I wasn't there, they'd be okay.
Yep. I think too, on top of that is like, it's more too, if you know and see who the medical director is, they're doing things legally. Like every practice technically needs a medical director. It depends on the state whether it needs to be an MD, NP, or PA. I don't think PAs could be medical directors. I'm pretty sure it's just NP and MD that can do it. I don't know if that's for every state, but.
Yeah. Let's talk about Hannah.
Yes. Our poor giggly squad girl.
Yep. She's on Summer House, or was on Summer House. That's where she started. Now she's a comedian.
Yep.
And she recently posted that she got Masseter Dysport from an aesthetic practice that she normally doesn't go to. And she ended up getting a really wonky smile after, and it went viral. People were kind of freaking out. I think that she was getting a lot of criticism for it. What do you think about it?
Okay, so I think it's really easy to be like, oh God, who did that to her and how did that happen? Like I've unfortunately caused a little bit of a crooked smile with masseters before.
I have too.
Never to that extent, but
it's usually one-sided.
Yes, yep.
Not both.
So just for patients listening, right? When you're treating the masseter muscle, which is one of the muscles that you use when you're chewing, it's in the back, kind of underneath your cheek area. It's a big, thick muscle back there. When you clench your teeth, it bulges, and we can really feel it and isolate it when we inject. There's a muscle that attaches from the masseter to the corner of your mouth that helps you pull and smile, pull your mouth open.
Yeah, it makes the smile wide.
Yep. So that's called the Risorius, and it lays very thinly on top of that masseter muscle. So if you're not injecting deep enough, or you're not injecting further back enough, you can hit that, and then you can cause someone to like not be able to smile wide. So that's what happened to her. Now, here's the thing. I typically use a 1-to-1 dilution of Botox only. I will do Daxi sometimes because I'm not so worried about the spread of Daxi, but I will never do Dysport in a masseter. I don't.
I don't either.
Because Dysport will spread more, technically.
Yes, and I use Botox Cosmetic anytime I'm treating the lower face because it's more precise in my opinion. Where I inject it, we know it stays. And I use a 2-to-1 reconstitution actually in the masseter. I mean, it's a big muscle. I go deep. I'm always marking from the oral commissure to the mid tragus. And then I'm having them clench and then putting my 2 fingers around that masseter muscle. So I'm palpating that muscle, feeling the severity of the bulge, right, of that muscle, and that's telling me how many units I need to dose for that masseter. But when we're injecting it, we're always injecting deep. If we go too superficial, there's that chance of hitting the Risorius, and then you're going to have some of that Botox leak into that muscle and cause a little bit of a wonky smile. But Dysport, and this is nothing against Dysport, but she tends to spread more.
Yes.
It's a little bit more, how do I say it? You can't rely completely on it, right?
On the amount in the amount of each
injection.
Yeah, injection point. Yes. Yeah.
So when you inject it, it likes to diffuse, which is great, right?
In certain areas, yes.
In certain areas, right? Especially really, strong muscles in certain areas, right? But with Dysport, there's more adverse events, in my opinion, in the lower face. So I like to use Botox Cosmetic there. And I know you use a 1-to-1 reconstitution. I use a 2-to-1. That just means I use a 2 cc or 2 ml recon when I'm reconstituting a 100-unit vial of Botox.
And I do a 1 ml. Anything from the nose down, I do 1 ml. But everyone's got their things.
They do. Yeah, exactly.
And I will say, too, the one time I got a really wonky smile from Masseters, she always did a really high dose. I'm like not even kidding. It was like 50 and 50 a Masseter. And she came back and we've been treating her for so long. And I felt her and I was like, I know these Masseters are not as strong. And she's like, nope, they're really strong. Just treat them heavy. And I'm like, in my head, I'm like, she doesn't need this dose. And then of course, so it can be from overdoing the dose too. They could have just given her way too much and then it just spread, more dosage equals more volume. So
I do think it's depth.
Yep.
I think it's the amount of units, and I think it's the specific neurotoxin, in my opinion.
Yep.
Truthfully. Yep. And that's not bashing anybody.
Anything.
Go ahead.
Yes. No, speaking of this, so basically we're saying I've never had a complication is not a flex, right?
No, it's not, because we've had them.
And when you've had them, you know how to deal with them.
Yes. And the reason why we've had them, and the more patients you see, the more, I hate even saying complications, the more situations
adverse events.
Sure. Or situations you don't want to deal with come up.
Yeah.
Right? It's just all about how you deal with them and how you act on it. And just knowing that you have the protocol and the complication management to deal with it and the reassurance for the patient, right? Because sometimes it can be scary for the patient. So just letting them know that you know how to handle it, it just eases their mind.
Yep, absolutely.
Right?
Yeah, I think
so. Hannah, you need to go to your normal injector.
Tell her.
I love you, treating you like a sister, mother, bestie, but you need to go to your main injector who always injects your face. Don't just go to a place just quickly.
Yeah, don't just pick anywhere random.
And it's funny, like, we were just at AES and I was having a conversation about Master Botox with a few providers, and some of them do Dysport. And they say that Dysport, because of the spread, there's more spread of Dysport and it's a bigger muscle with the Masters. They really want it to hit all of that muscle. But everyone's different. I just don't. I use Botox, more precise, does the job. There's an FDA indication coming out with Botox Cosmetic.
Very exciting.
Can't tell you what it's for, but it involves the masseter. I can't tell you the indication, though.
Can't say that.
Can't say it yet. Yeah, but it's really exciting.
Very exciting.
Yes.
Let's see. What else? Oh, this is a good one. What should patients be asking before letting someone inject them?
What's funny? Patients don't really ask me many questions.
Well, I think you do a good job of credentialing yourself online.
And there it is. I think that if you do a good job, you have a good social media presence, credential yourself, have good education, show yourself continuing education, right? Then I think that they're not going to ask you as many questions in the room.
It's not going to be an interview. Yeah.
Right. Right. So they're just going to go into telling you what their concerns are, looking at the mirror, and you can walk through what you're seeing and do a proper facial assessment.
Yeah. And I know Jon has done a whole talk on this, but I think it's so important as a provider to credential yourself on Instagram. Like I post, Jon hates me for this. I post several times a day.
I do not hate you. I honestly, it just gives me anxiety because I'm not doing a good enough job.
No, clearly you are. But
I don't know.
He did a whole talk on this at Modern Beauty Con about how you should be credentialing yourself online because it does help, one, bring more patients in, but then they trust you better.
And the consultation starts on social media. It just does nowadays. You know, and that's what I tell people. I mean, if you're not good on social media, you need to pay someone to do it for you.
Mm-hmm.
It's just, we're in that day and age where everybody has ChatGPT, they have Claude, you know, they're going online, they're researching everything before you're even coming in. Like someone today said that they were researching me for 2 years and they finally had the, like, you know, the courage to come in. And I'm like, that's amazing. And they're like, I've looked at other people, but it's your page that I, you know, went to because I felt like you gave the most education and, you know, you loved, I don't know. You know, that means a lot, but it's true. And it's a lot of work. But if you don't like social media, you need to pay someone to help you do it because in this day and age, you're not going to be as successful. No. Unfortunately.
I know.
You could be the best injector or really good injector, but no social media presence. I'm sorry. Not all of us can be like David Yolen.
No, exactly. He's the one unicorn that does not have Instagram and is just booked for like the next 10 years.
Literally, Dr. Yolen, like, not everybody can, but he was from a different era. So he built his name and now he's like, I'm not on Google.
Yep.
I don't do ads. And he's booked out a year or two.
Yeah. Yeah.
But that's just him.
Yep. And he was,
but now
you're like you said, it was before that era. Like he really got into it at a good time.
Yeah.
No, there was someone posted, I think, somebody, I think it was probably Erica Berry, honestly, put up like, you know, in today's day and age, you have to be posting in order to be successful.
Sure.
And there were some people that kind of took that and they were like, you know, you don't need to be on social media to have a good practice. And that's not what she meant. You know, you do not need to be on social media to have a great practice and a safe practice. But if you want to get yourself out there and get those patient numbers up, you have to be putting yourself out there on social media.
Yes. 100%,
because you have to, like you said, the consult starts before they even walk in your door. The consult starts by them seeing you online, credentialing yourself, showing your before and afters, and that's how they come in the door. So
100%. No, I totally agree. Let's see here. Is aesthetics growing faster than regulation can keep up?
Honestly, a little bit.
A little bit. It's growing so quickly.
We're just gonna be honest on this, guys.
One thing I'm really annoyed at though is that there's so many great treatments. I get really annoyed when some providers make such a fuss over certain treatments online.
Yeah, yeah.
Because a lot of people that are listening to this podcast, right? You guys are doing things the right way. You guys are in it for the right reasons. You have protocols. You know how to, you know, manage certain complications, and you would only offer treatments to your patients that you know were effective and safe, right? And you know, I'm really starting not to give a anymore, truly, and I really am. And the patients are always number one, but I'm sorry. Like
you're done with everyone's outside opinions.
I'm done with everybody's outside opinions, and I have the patient's, you know, health and their goals in mind,
and safety,
and they're living in safety. And there are so many treatments that are off label that are safe to do.
Yep.
And we have to start doing them. In my opinion, we have to evolve, and we have to move on. I'm sorry.
No, I agree with you. It's like, it's fun because our field is always evolving.
Are you kidding? Yes.
Then it is tough when certain things happen. And I will say there's no other field like aesthetics. Like we are out there on social media, and when something happens, it is just blasted everywhere.
It is.
But I will say, I think more on like the regulatory side, like I do think, and hopefully down the line, they can come up with some kind of like, I don't know, specialty, you know, like I'm a family nurse practitioner. Maybe we can have an aesthetics nurse practitioner specialty, you know, where my hours are actually in that, which would be nice.
I wonder if they'll ever do that.
I know. It would just be nice because then, like how I had the training.
I think they'll have a residency. I think they'll have like a fellowship program.
Like my quote unquote residency was in family care. So like I did urgent care. I did, you know, internal medicine, like, which is great. And obviously it set me up great. And I had my years of plastic surgery on my own. But it would be nice if you could go into something where you can do a plastic surgery rotation, you can do an aesthetics rotation, and you can get that knowledge before you graduate. Because then, like you said, you're never having to hire brand new injectors. They all have a little bit of a background.
Totally true.
But I do think they're trying. Definitely in New Jersey, I know it ruffled some feathers. They were There was basically a thing that came out during COVID that nurse practitioners could operate on their own. But it was for internal medicine to help with the overload of patients. And then they took that away recently. And then because they took that away, they started looking at rights for NPs, whatever. They gave autonomy to primary care and psychiatric NPs. But if you work in aesthetics, you cannot be your own medical director in the state of New Jersey.
What a pain in the
I'm
sorry.
Yep. So
it is. It's just so different state to state, which sucks, but it is what it is.
But I mean, it was just shocking to me. Like if we trust NPs to take care of the whole body as a whole in primary care and prescribe medications like that, we don't trust them to do that with aesthetic medicine. I don't know, but so we'll see how that progresses in New Jersey, and it's the same for many states. But I know in New York, you guys are lucky to have autonomy, but
for now, now, Nicole and I were just at Aesthetic Extender Symposium down in Boca. If you guys have heard of it, you guys should really, or if you guys have gone, to go again. It is honestly, truly, I love AmSpa. I love Aesthetic Extender. Those are honestly the top two in my opinion.
I think they're the top two for networking as well. Like they have so many
the
events.
Content.
Yes, yep.
The live injections.
The live injections at Aesthetic Extender were.
It was great.
Incredible. Like you would step out of like a lecture happening and there'd be like a little like live injection going on. You're like, wait a minute, what am I missing? You know?
Yeah, at all the booths. And then there was on stage and then there were in booth presentation. Like it was really, really good. And that's what providers want to see. They want to see the live injections.
Yep.
So, for any conference that doesn't have a lot of live injections, I think that's where the feedback will say, it was okay, but we want to see like
the
hands-on.
Yeah.
Yeah.
Let's give it up to you for a second for killing your first big debut.
Oh God, thank you.
Jon did such a good job, you guys. He injected live on stage. Well, he didn't just inject; he also carried the program with Brandis Harrison.
Yeah,
she's incredible. By the way, we love her to death.
It's great.
You two on stage, your chemistry was just amazing.
Oh, it's so fun. It's so fun to talk about things that you love to do, and honestly, like I was actually more nervous leading up to it just to get on stage.
Yes, yep. And then those first 3 minutes pass, you're good. Yep.
Oh my God. It's like, okay, let me hear my name. Let me go up there. Let me walk out and then you're good.
Just do it. Yep. No, you did amazing. I told Jon, I'm like, you found your calling. You're going to be on so many more stages.
It's such a calling. It's so fun.
Yeah.
It's like such a high. It's like riding a roller coaster.
Yep.
And then afterwards you're like, when's the next one?
Yep. Oh no, you did absolutely incredible.
Injecting. And you've injected on stage for Codafana.
Yeah. That was crazy.
And you, after, I know you were nervous, but like after you were like, wow.
It was the best thing I've ever done. Yeah.
I know.
Yeah. So cool.
So way more opportunities there too.
Yeah. We're very lucky to be a part of stuff like that. So
yes.
More to come.
Well, and I think too, if you are someone who's listening in who is interested in being on main stage or being on Podium and all of that, you have to really you have to go to these conferences and you have to meet people, say hi, introduce yourself, show your personality, have a social media presence. I'm sorry, but you do.
You too. Yep.
And you have to just put yourself in the room with the right people sometimes. Don't you think, Nicole?
I absolutely agree.
And sometimes we're tired. I get it. But like, if you do
have
want
to show face. Yep.
Because I think there was one stage of my life that I was like, oh, I'm struggling. Like, I want to get on there, but like, it's just not coming. And then I got out of my head and I was like, all right, let me put in the work, And once I put in the work, the opportunities started coming in.
No,
so
and I say it every day. It's about who you surround yourself with. Because if you're surrounding yourself with people that are getting up there and always challenging themselves and always doing more,
go-getters, right? Don't complain. If you're around negative people, it's never going to happen. You just want to be around positive people.
Yep. Like I think about all the amount I've had to travel since having Avery. But like, if I don't put my face out there, if I don't do these things and network,
so much as a mother,
and like traveling, but it's like you have to, and like I was so excited to hang out with you guys, but of course it's hard to leave, But it's about, you have to put your face out there and you have to be willing. You have to be willing to do those things in order to grow. 100%.
I agree with you. Totally. Well,
to summarize,
was a fun episode. To summarize.
To summarize, it doesn't matter how many followers they have.
Yes. It's true. Get on social media.
Yep. And post away, because even if you have 50 followers, it's still going to help you bring patients in the door.
Yes.
Weekend courses, they matter and they are necessary, but I wouldn't consider yourself like ready to open your own practice after taking one. It definitely takes time to have patients and models and feel confident, right? What do they say? Confidence is not competence. Is that the saying?
Yes.
Just because you're confident doesn't mean you're competent. I don't know.
Yes. No, it's true.
Right.
Like fake it till you make it kind of thing.
Yeah,
like, just, I get it. Yep.
And this is a good one actually that we didn't talk about. And then we'll stop yapping. Because we mentioned weekend courses, what does appropriate training actually look like?
Appropriate training?
Yeah, so I'll say my training, right? So
you say your training.
I was lucky enough, so I went to school, I went and got my aesthetics license, which is not necessary, but as a nurse back then, there was really no way to get into this. So I was like, let me get my aesthetics license. It's how I got my foot in the door in plastic surgery. I get the plastic surgery also because I'm a med-surg certified nurse, which I don't uphold anymore. That lapsed last year. But so I start working as a plastic surgery nurse, and that's where I started to gain my training. I got to see stuff in surgery. He trained me in injectables. I didn't touch an actual patient for 6 to 9 months. I had models. I would come in early. Guys, I also worked like 60-hour weeks. I'm not even messing around. I signed my life away in the best way. I did it so I could get training. But I worked like, no joke, 60-hour weeks. I would come in early. I would do models. I would go into surgery. I would follow the injectors, whatever. I didn't touch an actual patient for about 6 months. So I just think everywhere is different. Not everyone's going to have that, not everyone's going to get that kind of training, but I was lucky enough too. And I felt more confident because I felt competent in what I had learned because I had so long to learn it. And anyone that I was touching wasn't really a paying patient because in my opinion, they shouldn't have been because I really didn't know what I was doing yet. But I think having models and having a mentor is a really good way to get appropriate training.
Yes. And I have, I host private trainings for my staff. I would say at least 2, maybe 3 times a year, just to make sure that they're up to date, competent, and making sure that they're doing things the right way, and just following up. And they have a ton of questions too. I mean, we're seeing patients day in and day out, and I'm sure they have so many questions throughout the day, but they just don't have time because we're seeing patients.
And even like me and Jon, like I watched him inject on stage the other day, and I took stuff away that I'm going to change in my injection technique. So it's like, it's trainings matter for everyone, not just because you're brand new. Are you smiling at Corey?
At Fran.
Oh, hi, Franny.
Oh, Franny. Hold on. Oh my gosh, she cracks me up. For those of you that are listening again,
put her on. Give her your pod.
Oh my God, I can't. Why is it not open? Oh, it was open. Oh. Fran, do you want to say hi to the podcast?
Hi, Fran.
Yes, this is Fran Scuteri.
Oh my goodness.
Yes, and you're hearing my dogs. She owns Medicine Based Beauty in Syracuse.
She's the best.
Yep. Has hosted trainings with Leslie Fletcher, Wasim, Erica.
Yes.
Yep. And she's
Come
our neighbor.
Syracuse, we'll do something fun. Yeah, and she's Jon's lake house neighbor.
Yes, she is. Yep. I love it.
But
oh my God.
Yeah, don't be afraid to ask questions before people inject you. And I mean, that's that.
Yeah, proper training for me, you got to do a cadaver in the beginning. I would say at least yearly, the first couple years. I think that's important. And I think to do some allergen trainings, any products that you have in the office, if you're using them, you have to talk to your medical director or your boss to see if you can do, some trainings with them just to keep up to date on, and also meet some of these injectors that have been injecting for years and learn from their techniques and pick their brain. And sometimes it's hard, like you're in your little bubble where you are. So having these trainings really helps to, to think outside the bubble and not keep you so isolated. So I think that's important. And I think going to conferences, pick 2 conferences a year.
Yep.
Go to them. You can do 2 a year.
Yep.
If it's too much, do at least 1, but 2 is great.
No, so true. And I will say, until I started doing those conferences, I felt a little like stagnant and stuck in my injector career, And then I started going, and I met people like you and the friend group that I have now. And then you're with like-minded people. It changes everything.
It totally does. Yep. I couldn't agree more.
Yeah. All right,
Well,
guys,
on
this is a
that
great
note,
episode. Yes.
This is a great episode. Thanks for tuning in. We love you guys. And please continue to comment on our reels on Instagram. Message us. We love it. We love the collaboration and just, it's the best.
Yeah, and hopefully we see you guys soon at some conferences coming up with Mopsy.
Yes, I can't wait.
All right, guys. Bye.
Bye. Till next time.
All I want